Welcome everyone. A couple of words of introduction. My name is Kasia Rothenberg. I am neuropsychiatrist representing Cleveland Clinic and specifically Center for Brain Health. I have nothing to disclose for this talk, and today I would like to focus your attention on climate change and mental health. I will present to you a concept of climate change induced chain of events leading to mental health symptoms. We will review some data. I will give you a couple of examples. We will talk about populations particularly vulnerable to those phenomena. We will discuss as well something interesting, psychiatric syndromes specifically related to climate change. And I hope to save a couple of minutes for other considerations. Climate change is unquestionable fact, and more evidence is being gathered about its negative influence on human health. In 2016, US Global Change Research Program, the graph comes from this report, released the consensus opinion that climate change impacts not only medical and physical health, but mental and even community health. This is relatively new knowledge. Most of the data that we had so far is coming from the analysis of psychiatric symptoms in the context of climate change related natural disasters. All natural disasters, biologic, geophysical, and last but not least, hydrometeorologic, influence mental health. I don't need to remind you that we are living in the time of pandemic, classic biological natural disaster. We are all aware, of course, of pandemic influence on our mental health. One type of those phenomena, hydrometeorologic, represented by flood, storm, extreme temperature, heat waves, cold waves, drought, and wildfire could be specifically related to climate change. And hydrometeorologic natural disasters are definitely on the rise. In this graph, which I found in New England Journal of Medicine, hydrometeorologic disasters are represented by blue bars, which are definitely on the rise, much more than the brown bars, geophysical disasters. And as you see by looking at this red line, economic damage, economic burden follows this rise. We should be talking then about climate change initiated chain of events leading from global phenomena through economic hardship, lack of resources, lack of resilience, declining health. This is an interesting study I found in Science. In 2009, researchers looked into global warming. Global warming per se, it is an obvious phenomenon. We know that future summers would be much warmer than ever, but it leads to hunger. And because of that, the magnitude of hunger will be on the rise. We would expect that a population of people who experience hunger will double. Hunger leads to lack of resilience and declining health. Another example, flooding due to rising seas, flooding due to heavy precipitation, frequent heat waves, all are linked to economic damage, lack of resources, hardship, and deteriorating health, including mental health. Let's move closer to mental health outcomes. Let me give you a couple of examples based on data from relatively recent studies. Prevalence of all those listed here, sensu stricto psychiatric symptoms, had been rising during and after hydrometeorologic disasters. PTSD and depressions are the ones most studied. Let me start, however, with acute stress disorder. Acute stress disorder typically presents within 4 weeks of an extreme traumatic event. Dissociative symptoms of acute stress disorder are similar to PTSD and consist of sense of numbing, detachment, altered sense of reality, depersonalization, and dissociative amnesia. In the aftermath of Hurricane Katrina, researchers found that 62% of the evacuees met the criteria for a diagnosis of acute stress disorder. Many times, acute stress disorder evolves to post-traumatic stress disorder. This phenomenon is the most frequently studied psychiatric outcome of climate-related disasters. It is characterized by flashbacks, avoidance of stimuli specifically associated with trauma, hypervigilance, and sleep disturbance. PTSD prevalence ranges from 30 to 40% across different disasters among those directly involved in them. One study from 2007, Katrina population, so population affected by Hurricane Katrina, the prevalence was almost 31% in terms of PTSD symptoms. Another type of natural hydrometeorologic disaster, Fernandez and colleagues found a greater incidence of PTSD among victims of extreme flooding than in the general population. Impact of wildfires. Marshall and colleagues, this is a 2007 study, reported that 24% of those affected by a wildfire in California showed symptoms of PTSD, and the symptoms persisted. They were present in majority of victims at 3-month follow-up. Let's go back to Hurricane Katrina. Very well-designed study which looked into population of New Orleans before and after hurricane. This group of researchers was interested specifically in serious mental illness. And now what they found, significant increase in across the board serious mental illnesses by 89%, huge increase. Let's look at a split. Depression increased by 33%, PTSD similarly to previous studies by 32%, and very striking finding, suicidality increased by almost 62%, even though depression only by half of it. And again, the same population was looked into after a couple of months, and the symptoms tended to persist, which means definitely lower resilience. Depression. Depression is the second most commonly studied mental health outcome among survivors of natural disasters. Just to remind you, the symptoms of depression include feeling sad or empty, loss of interest, feelings of worthlessness, inappropriate guilt, changes in sleep, changes in appetite, and difficulty concentrating. A lot of smaller and bigger studies go back in terms of depression and natural disaster, analyze Katrina population. But here I wanted to quote for you a study of the mental health outcomes after wildfires. Very, very vivid and important to us currently subject. And they found that 33% of participants of the study exposed to wildfires met the criteria for a probable major depressive disorder. It's definitely not that high in any population. So significant influence of natural disaster. And last but not least, anxiety. Once again, Fernandez and colleagues analyzing people exposed to flooding noticed that exposure to this type of natural disaster correlates with higher level of anxiety, and symptoms included excessive worrying, restlessness, irritability, fatigue, difficulty concentrating, muscle tension, sleep disturbance, panic, and phobias. Let's put everything in sequence. Let's visualize the chain of events. Many effects of a climate change, such as extreme heat and violent weather, can harm people's mental health and well-being. Extreme weather, floods, and fires can threaten, damage, or destroy people and their homes, communities, loved ones, and social network. The threat, damage, and destruction caused by climate change can cause increased anxiety and depression in many people, especially children, older adults, and low-income Americans. I already started a segue to vulnerable populations. The quoted before US Global Health Research Program analyzed existing data and came to consensus that certain populations are especially vulnerable to natural disasters. And first of all is displaced people and forced migrants. Second on the list, extremely important to our topic, people with pre-existing mental or physical health conditions. Next one on the list, people of lower socioeconomic status. Many times that means communities of color. Fourth on the list, children and young adults. And last but not least, elderly, older adults. So far, we had been talking about classic psychiatric symptoms in the context of climate change-related natural disasters. A decade ago, however, interesting observation came to play from Australia. Glenn Albrecht and his team, he's a philosopher in Australia, studied population of people exposed to extreme drought and fires, which led to loss of their livelihood. And he noticed this interesting psychoerratic distress syndrome consisting of hopelessness, anger, sadness, and discomfort. He named it, he coined the term for this syndrome. He called it solastalgia, from solatium, which means comfort, and the Greek root algia, meaning pain. For last decade, solastalgia had been noticed, studied, and has become a central concept in the analysis of a cultural, personal, and mental health risks posed by changing climate. Another interesting term, which of course describes certain situation, It was even mentioned by American Psychiatric Association. It's not a formal diagnosis, it's just a noticeable syndrome. Eco-anxiety. Eco-anxiety was defined as a chronic fear of environmental doom. Now, interesting feature of this particular syndrome is that people who experience it are not necessarily involved in natural disasters. They are not necessarily exposed to it. So even knowledge about changing climate, knowledge about how climate may influence our lives, knowledge about the chain, this climate-related chain of events, it's enough to cause this syndrome, of course, in vulnerable people. To this point that climate change-related phenomena are considered as on a list of those things which people look into when they start a family, when they buy houses, when they move to certain areas, etc., etc., etc. Sometimes very limiting, sometimes extremely anxiety provoking, sometimes eco-anxiety needs treatment. I wanted to pause for a while and segue towards a little bit more positive observations. So a couple of thoughts on a positive note. I wanted to mention to everyone that I am glad that awareness of a climate change and mental health is rising. I present to you 2 pages from internet pages. There is organization, the movement of a name Climate and Mind, and another organization of a name Climate Psychiatry Alliance. Both gather a lot of specialists, psychologists, psychiatrists, therapists, a lot of discussion, a lot of data, sharing opinions, a lot of awareness. Here in Cleveland Clinic, we have as well environmental sustainability professional staff engagement program, which I belong to. And because of this interest, more and more studies are being designed to look into, once again, positive side of nature. How nature influences positively our health, especially mental health. And I present to you here a review of 11 big studies, which together would include almost 800 participants, which was showing us data to support the statement that exercise in nature, interacting with nature, has a great effect, much more prominent than other type of exercise on our well-being, especially mental well-being. On the same note, I don't know how many of us are aware of something which is called forest bathing. This term and movement came to us from Japan. Shinrin-yi means exactly forest bathing. And what does it mean? They looked into population of people even once exposed to relaxation in nature, in the forestry areas, as opposed to populations of people resting or relaxing in different setting. And huge impact, much better outcomes in all kinds of outcomes measures, especially influence on mood, improving mood in those even once exposed to forest bathing. And I will pause now open the floor for discussion and leave you with, with Shinrin-yi and its good influence on both physical and mental health. Thank you.